Hi, good morning everyone. I am Rahul Nanuhal, COO at Cureka.com, and we are here today again for our Instagram live session. Today's session is with a very special guest who is an ENT surgeon, and she is going to talk about a very important topic, that is sinusitis. About Cureka, with all your love and good wishes, Cureka is growing very fast, and we have now reached new heights and opened new store at 12th Main Indiranagar, Bangalore. So we have our guest with us. Good morning, Dr. Stella. Thank you for joining us today.
Good morning. Good morning, everyone.
Yeah, great to have you. And doctor, we are going to cover the topic of understanding sinusitis today.
Yes.
It's a very common topic which, a lot of people are suffering from sinusitis and the related allergies that come due to this issue. So do you have some words before we start on our discussion?
So just to give a general introduction of what is sinusitis. So basically we have air pockets in the skull behind our face, which makes our head lighter, so that, and then it helps us to carry our head very light, and it also helps us during our speech, so that we don't have that stuffy voice and a clear voice, the voice we have now. So these are the air pockets that help that. So we have totally 8 pockets. The 2 are situated here, 2 here, and 2 behind the nose, and 2 big ones here. So these are called the sinus. So when we get any common cold or any infection, we tend to, the air in the sinuses, they get filled with water and infection. That's when we call it as sinusitis. So we'll talk about it one by one.
Sure. And what do people experience when they have sinusitis? Do they experience pain, itchiness, or how does it experience like?
So typically sinusitis usually starts after a patient gets a common cold or recurrent sneezing, or if patients have allergy, they are more prone for sinusitis. It can also be because of a dental procedure, toothache can be, or because of any accidents that has happened and disrupted the facial bones. All these can lead to sinusitis. So the patients can have headache. Headache can be typically seen in this region, and they will explain it as a dull, aching headache. And they will also say when they look down, they have that heaviness on their face, like as if the face is being pulled to the ground. So that is one. And they can also be one side or on the both sides. And they can also have facial pain. As I said, we have 2 big sinuses here, so they can have facial pain. If it is worsened, if it is there for a long time, they can also have ear pain also.
So a lot of people have sinusitis, and especially it's difficult for people who go out for work, right? So let's cover the questions that we have from our listeners and see how we can help them today. So doctor, what causes sinusitis, and are there any risk factors that can increase the likelihood of developing it?
So what can cause sinusitis? Like I said, we have these air pockets behind our face. So they all they are big air pockets, but the way they drain, the opening is actually very small. That's the whole problem happens with sinusitis. So we have an infection like a common cold, and we sniffle, we take the fluid inside. So a lot of secretion goes into the sinus, and the sinus produces, the lining of the sinus produces a lot of fluid. But it will not come out because it stays inside. It doesn't know how to come out because the opening is very small. So that's when we call it as sinusitis. The blockage of the drainage of the sinuses gives us sinusitis. The likelihood of developing sinusitis is more in patients, in kids, in small children who have frequent common cold. They can have sinusitis actually, but for them the most common sinuses that are affected are the ones which are above the eyes. We call it as frontal sinuses. But in the adults, the most common sinusitis is the sinuses behind our cheeks. We call it as maxillary sinus. In adults, that is the most common sinusitis because of the small outcome pathway.
Right. Right. Understood. So, guys, all of the listeners who are listening to us, and later on, once we upload this video across Insta and the other channels, if you have got any questions for our doctors related to any health concerns, you can ask us by posting in the comments section below, or we have got a free of cost WhatsApp platform. It's a direct to doctor WhatsApp platform on Cureka website. Log into the site or directly reach out to our WhatsApp platform. Ask your questions around any health concerns or any suggestions, any feedbacks, or any product recommendation that you want to have, and our doctors will come back to you within a couple of hours. So each and every query is answered across India, and people do benefit a lot through this free of cost platform. And then we have got another update that is coming in, that Cureka has now 500 plus national and international brands of great repute. These brands are carefully handpicked and chosen by a team of doctors, and only after they have vetted them and approved them that they are enlisted on the website. Not like any other platform where you have got random cosmetic brands on your website. We have got very, very niche and cosmetic and handpicked brands on our website. So whether it is related to skin care, hair care, nutrition, wellness, elderly care, pain management, maternity care or baby care, we have got more than 500 plus brands and 10,000 plus SKUs, 10,000 plus products for you. Right. So coming back to our discussion, doctor, can sinusitis lead to serious health complications if left untreated?
Yes, sinusitis can cause complications if it is left untreated. So we have two groups of sinusitis. One is based on the duration. We call it as acute when it is less than 4 weeks. When the acute episode is not treated or partially treated, they tend to have chronic sinusitis where the patient develops all these symptoms for more than 5 weeks or more as chronic sinusitis. So there are complications for acute and chronic. Acute both can affect the eyes because the eyes are very close to the sinuses. They can affect the tooth, and if the patients are old and they have other illnesses, for example diabetes, where their immunity is not that great like us, they can develop complications from sinusitis, like they can grow a fungus inside the sinus, which can go into the eyes and also to the brain, which can be life-threatening. So these are the complications. Acute sinusitis can cause pus collection within the sinus pockets, which can be very painful and will require surgery if there is pus collection. So these are the complications in general that can happen because of sinusitis.
Right, right. So better is to go and see a doctor if you are experiencing sinusitis, and then ENT specialist is the right doctor for you. So what are the common symptoms, doctor, of sinusitis, and how are they typically diagnosed?
So the common symptoms, as I said earlier, they usually say it typically starts with an episode of a common cold where they have traveled elsewhere, they drank something fuzzy, different, or they went to a group event where they got some infection, viral infection or something. So they start having some running nose, and then they develop this nasal block, headache with the facial pain. So this three characteristically says that the patient has developed sinusitis. Also, when they swallow their saliva, they feel a sticky secretion in their throat, which we call it as post-nasal discharge. That is very characteristic of sinusitis, which is basically the secretions that are inside the sinuses are leaking and coming out and coming to our throat. So that we call it as post-nasal discharge. That is characteristic of sinusitis. So all these are the symptoms to point towards sinusitis, and they can be diagnosed based on the history, the classic headache and head heaviness while looking down. And if we touch those areas and press a little bit, they can wince in pain. That can be seen in acute sinusitis. And chronic sinusitis can be diagnosed by endoscopies, outpatient procedure, nasal endoscopy, and X-ray of the sinuses, and to the end, CT scan. All these can diagnose sinusitis.
Right, right. And how do nasal polyps contribute to the development of sinusitis, and can they be treated, doctor?
So nasal polyps, again, they are the mechanical obstruction causing the outflow drainage, outflow failure. So the sinuses, usually what happens is the patient develops acute sinusitis, not treated well, end up having chronic sinusitis, not treated, then they develop polyps in the sinus. So that is how it usually happens. But there is also another group of polyp which comes from the nose that can block the drainage of the sinuses, and they can have all this sinusitis complications and sinusitis developing. So the treatment for polyps, as long as we say it is sinusitis, we can treat it conservatively or medically. But once we say it is polyps, it has to be removed surgically. Surgery is the only option for polyps.
It looks like doctor is experiencing some internet issues. Yeah, doctor, we lost you a bit in between, but we got the gist of what you said. Can you just summarize what you said, if that is okay? We lost you in between, towards the end.
Okay, so as I said earlier, sinusitis usually develops polyps. There's one group of polyps which comes from the nose and not from the sinuses. They can go and block the opening of the sinus and can cause sinusitis. It is either ways. It can create that can create this. This is one. But the treatment for polyps, once polyp comes, it's a three-dimensional pathology sitting there. So it has to be treated and removed surgically. There is no medical or conservative management for polyps.
Understood, doctor. Okay. So, doctor, what is the difference between acute and chronic sinusitis, and how are they treated differently?
It is based on the duration, basically. Acute sinusitis is when we call the symptoms of all the sinusitis happens less than 4 weeks, and it resolves with medications or by itself. But when acute is not treated or partially treated, where we take antibiotics, if we are prescribed for 5 days, let's say we take for 2 days and leave it off, that is partially treating the sinusitis. So that kind of acute sinusitis can go in for a chronic. When we have symptoms lasting for more than 12 weeks, that's when we call it as chronic sinusitis.
Okay. And can sinusitis be effectively treated with over-the-counter medications, or is it a prescription necessary treatment?
I think over-the-counter medications are not for sinusitis, because if there's a headache or if there's only a running nose, then over-the-counter medications can help. But this is a group of symptoms, and the pathology is somewhere inside which requires prompt diagnosis and treatment by a trained ENT surgeon. Otherwise, we can miss out, partially treat it, and actually lead the way for a chronic pathology. So I would say if they have all these group of symptoms, the nasal obstruction, the headache, and the postnasal discharge, it is better to consult an ENT doctor, see what is happening, get the proper antibiotics or a course of medications or nasal sprays, get yourself treated. The earlier is better.
Right. Okay. And how long does it typically take to recover from a sinusitis surgery? and return to normal activities?
Sinusitis surgery, we are talking about the endoscopic sinusitis sinus surgery. We at least need 3 months, 12 weeks of, it's a long recovery, because we call that as a functional endoscopic sinus surgery. It is not only removing the pathology. We actually go in through an endoscope which is smaller than the size of a pencil through our nostril, and we go inside our nose, open out all the 8 sinuses, behind our face. We open the mouth of every sinus and make it big, so that there is no more accumulation inside. The drainage is all fine after that. And then there is, we are giving the function of the sinuses back. Again, they can function as air pockets. Again, they can actually give the lightness to the face. So that's why we call it as functional endoscopic sinus surgery. But the patient have to follow a lot of saline rinses and steam inhalation for 12 weeks following the surgery, for the surgery to become a long-term success. 12 weeks recovery time.
That's quite a long recovery time. And are there any home remedies, doctor, that can help prevent or alleviate, which means to reduce sinusitis symptoms?
Yes, there are. I think everybody will know, everybody, even the small kids, the moment they say there is sinus, they all think about steam inhalation. Of course, it is a very right answer. The moment we start having the headaches, right after a common cold, we have a headache and we feel that heaviness of the face, we can start steam inhalation at home. There's no need to put any irritant or Vicks or any kind of tablet. Nothing is needed. Just water, boiling water, steam for 10 minutes thrice daily is enough to open up the sinus mouth, so that there is no accumulation inside and there is no development of sinusitis. But if they continue to have symptoms for more than 5 days, the pain is not coming down, and they think the headache is becoming worse, they have to see a doctor.
Okay. So, but multiple times steam would help initially if the sinusitis is not very extreme.
Yes.
In that case.
Thrice daily.
Thrice daily, okay. So can sinusitis be triggered by allergies, doctor, or any other environmental factors, and how can these be managed?
Yes, of course. Allergy is something that is happening in the nose. We come into contact with dust or any cold water or anything like a bird or an animal fur. So what happens, the tissues inside our nose, they swell up. That's when we get that nasal stuffiness, sneezing and all. Once that happens, automatically the sinus drainage also gets affected, because all the tissues are swollen, so there is no way for the ventilation to happen within the sinus. That can actually aggravate sinuses. When we say environmental thing triggers for sinusitis, like when we change our living weather conditions, like suddenly we are exposed to the cold, we can have sinusitis. Or if somebody is going for deep diving swimming or paragliding and all, then they can have sinusitis following that. It's mainly based on the theory that the nose gets blocked, that causes blockage of the sinuses, and they can have sinusitis following that.
Okay, right. And what role of nasal sprays and decongestants play in the treatment of sinusitis? Are there any potential side effects to be aware of these sprays and decongestants?
So we give 2 kinds of sprays in sinusitis. One is basically a saline spray. Saline is nothing but sodium chloride in water. We give that spray. So that is given with a pressure. So when we press it in the nose, it clears out all whatever secretions are there, bring it to the throat, so that the sinuses are having some breathing space devoid of the secretions. That is one saline to clean out the nose and the sinuses. The other is actually the drug. We give micro dosing of steroids, the safe kind of steroids. So these are not steroids like how we take by mouth, which is going to the liver and causing all the side effects. These are the ones that are going into the nose and gets out by the lungs. So these does not have any side effects.
Okay.
These are also the treatment for sinusitis. Only when we actually diagnose them endoscopically, seeing there's no other issue, it is only sinusitis, then we can start them on such steroids. But I would say less than 2-year-olds and pregnant women cannot use the steroids, because still animal studies say these safe steroids can cause side effects for pregnant and small kids. Other than that, there are no other side effects.
Okay. So kids and pregnant women should try to avoid them. Should not take. Okay. How does endoscopic sinus surgery work, doctor? And what can patients expect during the recovery process? So
as I said earlier, endoscopic, we call it as FES, functional endoscopic sinus surgery, FESS. That's what nowadays it has been done globally, I would say. So we go through the nose, we open out all the eight sinuses, we open their mouth, we see if there is any thickened lining because of the infection, we strip that off very carefully without damaging the bone. So basically we are stripping out the lining, which can grow back, which will grow back healthier when we give it some time. So this is how endoscopic surgery works. The moment we operate, now all the sinuses are exposed and they are big. Now we start them on sprays and drugs. So the drugs can reach all the sinuses now that we have opened the mouths. And there is no recollection or occurrence of sinusitis anymore, because the drugs can reach and the drainage is improved. So it's a win-win situation. And they have to have the saline rinses for at least 3 months, because within the 3 months, the new healthy lining starts growing within the sinus. Then their function is back to normal. So the recovery phase is little difficult because they have to use that saline rinse thrice daily for 3 months. That's when the prognosis is very good.
And can sinusitis reoccur later on once it is treated and it's recovered?
Yes, can. Once, if the sinus opening is closed again because of some other infection, some layer growing again, then again the sinus can get blocked. We can again have sinusitis. Then they have to undergo a resurgery, but it does not happen very commonly if we are very careful. Like you, post-surgery patients, if they find out any small symptoms that is coming, like frequent cold, they have to come and get checked with their doctor at least once a year. Like, how is their surgery post-op area? How does it look? Is it healthy? Am I all right? Or if they are becoming diabetic, all that should be checked every year. Then they are on the safe side. If it is not, if it is left not seen properly, regularly by a doctor, then they can have developed sinusitis and blockage again. They can go for resurgery.
Right. So any particular type of profession, specific profession is more, susceptible to, sinusitis, like maybe people who are exposed to more dirt or sunlight. Is it something like that?
No, I would say, but people who are exposed to more of dust, farming, who are working in factories and industries where there are a lot of fumes, which is actually irritating your nasal mucosa, they can develop problems in the nose, which can develop sinusitis. But directly something causing sinusitis is not very common. But there are tumors that are growing within the sinus. They are not infection, they are tumors. People who are working with the wood, like wood cutting and the trimming of the wood, where the wood dust goes into the nose, they are prone for tumors, cancers of the sinus. That is there.
Right. And any particular age groups get, more chances of getting sinusitis?
Sorry, I didn't get you.
Let's say kids or adults. So any particular age group is more prone or is more susceptible to sinusitis, let's say kids or elderly people who are more prone to it?
I think I would say the extremes. The smallest, the small group, they tend to have sinusitis because of the frequent cold they get, and they can also go for complications very easily than the adults. They can get infected fast and they can have pus immediately within the sinuses. And I would say the other extreme of the age, the elderly people, where and mostly when we become old, we tend to attract a lot of chronic diseases like diabetes. That is actually the culprit. So our immunity is down.
Right.
So we get sinusitis, and then we start growing fungus in that. So that is again bad in the elderly age group also.
Right, right. So guys, we've got a number of products on Cureka.com which can help you for a number of healthcare concerns, be it your anything related to pain management, elderly care, or baby care or maternity care. Do check out the healthcare devices section where we have got a long list of top brands and products which can help you lead a healthy life. Right. So coming back. Can chronic sinusitis impact a person's sense of smell and taste?
Yes, definitely. That's a very good
Okay.
question. So the smell is usually happening in the topmost part of the nose, where we call the roof of the nose.
Looks like doctor is experiencing some internet issues. So guys, as I was explaining that in Cureka website, we have got more than 10,000 plus healthcare products which are available, which you can choose to lead a healthy life. All these products are handpicked by a team of doctors. You can rely Cureka for a healthy lifestyle, for healthy advice, and anytime advice from the doctors. So do check out our WhatsApp platform, connect with the doctors, and get advice for free. So coming back now, doctor is back. We see her internet is working. So doctor, yeah, you were talking about sense of smell and taste.
Yeah, the sense of smell goes through the nose roof, the topmost part of the nose. So when sinusitis happens, there is swelling of all the lining skin inside the nose. So the smell particles, the air with the smell particles which takes it into the nose and goes to the roof, that gets blocked because of the poor ventilation pathway that is happening due to the sinusitis. So the smell will not be effectively transmitted to the brain. So yes, we can have reduced smell, and we can also have complete loss of smell if the patient has a long-standing chronic sinusitis. They can have completely loss of smell also. That can happen with sinusitis.
Right. Okay. And how does smoking or exposure to secondhand smoke impact sinusitis symptoms and treatment outcomes?
It's the same again. The smoking is going to irritate the nasal mucosa or the nasal lining. Then again, it's going to get swollen up, which is going to obstruct the drainage pathway. The smoke as such does not get into the sinus and cause sinusitis, but it gets into the nose, and through the nose irritation, it can block the sinuses. There is no direct relation to it.
All right. So coming to our last question for the day, doctor, because we're running out of time, can sinusitis be passed from person to person, and are there any preventative measures to take if someone in the household has it?
No, sinuses does not pass from a person to person. So we can say common cold can pass from a person to person through the infections, but once it gets into the sinuses, it cannot pass because it is well within the sinus. The secretions will not even come out. It directly goes to the throat, and if at all we sneeze it violently and then we expose people to it, maybe then. But sinusitis per se, it is not contagious from a person to person, but common cold is, not sinusitis.
Okay. Right. So sinusitis is not contagious, common cold is. Thank you so much, doctor, for today's session. This has been a fabulous session. I'm sure people loved it and they got a lot of insights out of it. Guys who have joined us late, do not worry, because we are going to post this video live on Instagram and also going to post it on YouTube channel. You can watch it there and do get a lot of insights from Dr. Berenice Stella, who is an ENT surgeon. Now, we are going to have another session today in the evening at 5 p.m. with a very special guest who is an acid attack survivor. Her name is Binda Bashani, and Binda Bashani is going to share her story of how she came up after an acid attack, which has been treated in by a doctor in Madurai, by a dermatologist in Madurai. So do watch this session today. 5 p.m. will be live with Binda Bashani. Okay, we have got one question coming in from a listener who says, Sir, मुझे chicken pox हो गया, उसके dark spots रह गए. Please suggest something to remove this. Dear, this is the session about ENT. We will pass on your question to our dermatologist who will come back to you. Please give us some time and we will come back to you on your query, because this session is about ENT. Thank you so much, Dr. Berenice Stella, and great. Have a great day. We'll look forward to having you again with us.
Thank you. Thanks for the opportunity.
Thank you, doctor. Thank you.